Hi, this is Dr. Mrinalini Sharma. I'm a plastic surgeon practicing in Aestiva Clinic, Sake. So today in this YouTube live series, we're going to be talking about thigh liposuction and also uh, some other techniques of lower body contouring. So when we're talking about lower body contouring, we essentially mean shaping the thighs and there are some surgeries which we perform, there are some procedures which are done to improve the contour of the lower body. So, first, let's talk about thigh liposuction. So, thigh liposuction basically aims at giving you more slender and appealing thighs, and this is done in cases of people who have a very bulky thighs, or some people whose thighs might be slender, but they have some very specific problems like people have something called saddlebags in which the thigh overall is slim, but then there is a bulge at the side of the thigh which is known as a saddlebag. So that can look very annoying for the patient when she's wearing something tight. So people who are wearing jeggings, people who are wearing tights might have those ugly bulges in the sides which are really annoying for the patient. So uh, one part of thigh liposuction involves basically not really reducing the bulk of the entire thigh, but shaping these saddlebags or these side bulges, which are very visible when the person wears something which is body fitting or body hugging. So the other area of concern usually when we're talking about thighs is the inner thighs. So people often complain that the inner thighs rub against each other and which can sometimes even be a functional problem that because of the excessive rubbing of the skin of the inner thighs there can be some amount of soreness, there can be chafing of the thighs, which is again very irritating for the patient. So sometimes patients come to us with very specific complaints कि वो जो सैडल बैग्स हैं वो अच्छे नहीं लग रहे हैं या जो आपकी जो इनर थाई जो है जो एक दूसरे के अगेंस्ट रब हो रही हैं वो अच्छी नहीं लग रही हैं. सो ये एक कंसर्न है जो पेशेंट्स की होती है जब वो हमारे पास थाई लाइपोसक्शन के लिए आते हैं. सो दीज सैडल बैग्स और these as I said, inner thigh rubbing against each other. These are two problems which are very specific areas which are addressed while we do a thigh liposuction. So overall, when we're talking of thigh liposuction, we're also going to be addressing other areas. So the front of the thigh, the inner side of the thigh, the outer side bulges, the back of the thigh, all are going to be addressed during a liposuction surgery. Now, two, three things which we want to tell our patients when when we're talking about a thigh liposuction. Number one, थाई लाइपोसक्शन जो है वो कुछ प्रॉब्लम्स हैंडल कर सकता है, कुछ प्रॉब्लम्स उससे ठीक हो सकती हैं, कुछ प्रॉब्लम्स हैं जो उससे एड्रेस नहीं की जा सकती. सो इफ यू वांटिंग एन ओवरऑल रीशेपिंग ऑफ योर थाई, यस दैट इज पॉसिबल विद द थाई लाइपोसक्शन. बट अगर आप चाहते हैं कि सारा सेलुलाइट चला जाए, सारे स्ट्रेच मार्क्स चले जाएं, तो वो नहीं होने वाला है. सो cellulite is a problem which is at a different level. So there is a component of fibrous attachments of the tissues under the skin to the skin causing a dimpling, which is essentially what cellulite is. And वो problem जो है liposuction से treat नहीं हो सकती. इनफैक्ट इन सम केसेस हम पेशेंट को ये भी समझाते हैं कि वो प्रॉब्लम बढ़ सकती है अगर हम थाई liposuction करें. So when patients come to me saying that doctor, I have a lot of cellulite and I want liposuction to cure that, so that is not going to happen if we do just a liposuction. Yes, there are other techniques, there are liposuction. So stretch marks, in fact, are might look a little more apparent once you have done a thigh liposuction, simply because जो skin है वो थोड़ी सी the stretch marks kind of come together, they get crowded. So instead of lessening, in fact, if we overdo a thigh liposuction, the thigh stretch marks might become more evident. It's not just the thigh, I'm talking of any area of the body. If we do a thigh liposuction or if we do a tummy liposuction and there are existing stretch marks, then the stretch marks can in fact look a little worse after a liposuction. So let's not look at liposuction as a technique to reduce the stretch marks. So there goes cellulite, there goes stretch marks, which cannot be really treated by a liposuction surgery. Yes, the main problem, as I said, what we address using a thigh liposuction is those ugly side bulges, which are usually the most common complaint or the most concern for which the patient wants to undergo a thigh liposuction. We can also target the inner thighs and we can create that desirable inner thigh gap, which many patients ask for. So that is another thing which can be created using thigh liposuction. Now, there are various kinds of liposuction. As we all know, we use lasers, we use, we're going to be using sometimes bar assisted liposuction. अब हर patient की अपनी अपनी indications होती हैं. So if you want that, we create some amount of skin tightening also. So nowadays, most of the plastic surgeons all around the world are using laser, which is an ultrasonic device, और बेसिकली we're using any form of ultrasonic liposuction, जिससे कि liposuction के साथ साथ जो skin tightening है वो भी कुछ extent तक होती है. Again, at our center we also have a device called body tight, which is going to again employ radio frequency to tighten the skin. जैसे हम साथ साथ liposuction करते हैं उसके साथ साथ हम body tight कर देते हैं जिससे कि skin जो है वो tighten हो जाती है. So these are good options when we're talking of techniques to tighten the skin along with doing a liposuction. So we're going to be using a basal liposuction. Number one, as I said, which is an ultrasonic liposuction. And in addition to that, we are going to be using this device called Body Tight, which is going to tighten the thigh skin. And I always tell my patients that when you talk of thigh liposuction, the aim should not be to remove every last bit of fat, because the problem with thighs is that if you overdo the thigh liposuction, then the chances of sagging increase. So it's basically to do with gravity. So it's simple gravity that the skin tends to sag down, and it's more in the lower limb compared to the arms or compared to the tummy. So I always tell my patients that let's not try to do a very aggressive job when we're talking of a thigh liposuction, because we don't want that the liposuction has been done, but the thigh looks all loose and saggy. So that's one thing which we have to keep in mind when we're doing liposuctions of the thighs. Now let's talk about another part of body contouring, which is uh, tightening the skin of the thighs. So this is indicated when the patient has loose skin. Now ऐसे patients आते हैं हमारे पास जिन्होंने weight loss किया होता है, तो 20 kgs lose किए होते हैं, 30 kgs lose किए होते हैं. So वो जो category है जहाँ पे weight loss हुआ है उसमें क्या होता है कि the skin is not able to contract to that extent. So आपने weight तो lose कर लिया, but the skin fails to go back to as tight or as firm a look as it would have been in a person who was originally thin. So that is again where we perform a surgery called a thigh lift. So thigh lift is a surgery which is indicated for somebody who has lost weight and now has loose skin in the area of the thighs. So थाई लिफ्ट से बेसिकली हम क्या कर रहे हैं कि जैसे हम टमी टक में टमी की एक्स्ट्रा स्किन निकाल रहे हैं, वैसे ही हम थाई लिफ्ट में अगर कोई ऐसा पर्सन है जिसने 20-25 kgs लूज किए हैं, समटाइम्स मोर लाइक इन अ बेरियाट्रिक सर्जरी जो 40-50 kgs लूज करके आते हैं, जिसमें अगली bangs of skin are remaining on the thighs and they give the thigh a very, I would say, old kind of a look, aged kind of a look. तो thigh lifts are the surgery to go for. तो उसकी भी बहुत सारी टाइप्स होती हैं डिपेंडिंग ऑन द एक्सटेंट ऑफ द लूजनेस कि अगर बहुत ज़्यादा लूज है स्किन तो एक अलग तरीके का थाई लिफ्ट किया जाएगा, अगर कम लूज है तो हम एक डिफरेंट तरीके का थाई लिफ्ट प्लान करेंगे. अब इन दिस वी हैव वर्टिकल थाई लिफ्ट्स, वी हैव मीडियल थाई लिफ्ट्स. सो दीज ऑल विल बी डिसाइडेड व्हेन द प्लास्टिक सर्जन असेसेस यू एंड सीज की क्या है जो किया जा सकता है. सो इफ यू आर गोइंग टू कम विद अ लॉट ऑफ लैक्सिटी देन प्रॉब्ली विल बी टेकिंग यू अप फॉर अ वर्टिकल थाई लिफ्ट. नाउ वर्टिकल थाई लिफ्ट में क्या है कि हम स्किन जो है वो इनर साइड ऑफ द थाई से निकालेंगे एंड it's an excellent technique, but the only thing is it is going to leave a scar in the inner thigh. So that is one kind of thigh lift which is done. अगर हमें लगता है कि no, it's not a very excessive amount of sagging, then we can go for something called a medial thigh lift, जिसमें जो कट है वो आपकी ग्रोइंग के एरिया में दिया जाएगा जो ज़्यादा विजिबल नहीं होता है. So that is something which we can do if your laxity is not too much, if it's a mild to moderate laxity. But anything more than that, usually a vertical thigh lift किया जाता है. Now thigh lifts are very good surgeries in terms of removing all the excess skin. But what we have to understand is that the only thing against thigh lifts is that they are going to leave scars. So especially the vertical thigh lifts where inner thigh में एक लंबा सीधी line जाएगी ही जाएगी. So that is something which the patient needs to know before he or she contemplates getting a thigh lift done. And yes, the scars do fade well with time and you are left with a good, tight thighs. But then the scar is going to remain. However much it might improve, it is never going to completely fade away. Yes, and again, दो जो आपका medial thigh lift है जो आपके groin crease में plan किया जा रहा है, that is not really possible where you're going to uh, it's not going to be possible in every case. Okay, so Swikriti is asking for live sessions related to rhinoplasty. Okay, so next time definitely we will do something on rhinoplasty also, and if you have any specific topic in rhinoplasty also जिसके बारे में आप जानना चाहते हैं, so do let us know, and we will definitely get back to you with the requisite live session. क्योंकि शायद हम rhinoplasty पे एक live session तो कर चुके हैं, but yes, definitely we'll be doing that. So you can just pick up any specific topic and we can talk about it. So yeah, coming back to lower body contouring. So thigh lifts are another form of lower body contouring in which we are going to be addressing the excessive skin in the thighs. Now there's also another part of lower body contouring, which is the lower body lift. A lower body lift is basically again done where there is a sagging of the entire lower body. So in this there might be we're going to be dealing with not only the thighs but also जो आपके sides हैं जो बिल्कुल लूज स्किन हैंग कर गई है या आपका जो butt area है जहाँ पे स्किन जो है वो बिल्कुल लूज हो गया and the butt is hanging down. So again, these are all surgeries which are designed for massive weight loss patients where the butt area is all loose and saggy, it's droopy, the thighs are all saggy, and the inner thighs again in folds. Many times patients have these ugly folds simply because of excessive weight loss. Now this is a candidate for a lower body lift where we are going to be addressing all these areas. जो हम inner thigh की skin भी ठीक करेंगे, हम आपके front of the thigh की skin, the side of the thigh, and आपका जो बटक का जो droop है, जो gluteal area का जो droop है, उसको भी हम address करेंगे using this technique of lower body lifting. Now, each of these surgeries, starting from a thigh liposuction to say a medial thigh lift, to a vertical thigh lift, to a lower body thigh lift, जैसे जैसे मैं आपको सर्जरीज बता रही हूँ, इनका जो हीलिंग है वो अलग है, इनका जो पोस्ट ऑपरेटिव केयर है वो अलग है. So just when we talk about liposuction, like liposuction anywhere else in the body, this is a surgery which does not involve any scars. इसमें कोई scars नहीं होते हैं, इसमें कोई लंबी dressings नहीं चलती हैं, and there is no requirement of prolonged period of rest. So we always tell our patients that you can resume work as soon as possible, as soon as you are comfortable. चलना फिरने की कोई restriction नहीं होती. In fact, we want our patients to start walking as soon as possible because it has been shown to improve the healing rates. And उसके अलावा जैसे when we talk of your inner thigh lifts, inner thigh में भी होता है कि जो vertical lifts है जहाँ पे आपकी sky inner thigh की जो skin निकाली जा रही है उसमें yes you will have a stitch mark and you will probably need to come for dressings and you'll have a period of follow up of about 2 to 3 weeks with us जिसमें हम dressings करेंगे जिसमें हम आपको बताएंगे कि उस area का कैसे ख्याल रखना है. Similarly, again, medial thigh lifts will be same. Dressings are going to continue. Most of the stitches are going to be absorbable stitches. वो dissolving stitches होंगे. कुछ areas में हम लोग आपको ऐसे stitches लगाएंगे जो निकालने होंगे. So overall, if you talk of healing and if you talk of return to work, then if you're doing a thigh lift, then the recovery is a little longer compared to just doing a thigh liposuction. And indication जैसे मैंने आपको बताया दोनों के अलग-अलग हैं. हम thigh lifts तब करते हैं जब weight loss के बाद we have a lot of loose skin in the thighs or in the in front of the thighs or in the inner thighs where patients have that crinkly loose skin which they don't like and उनको लगता है कि हाँ weight loss तो कर लिया सब कुछ कर लिया but skin बच गई है जो किसी भी तरीके से नहीं जा रही है. So that is usually a surgery which is designed when a person has lost weight and she wants to wear say a short skirt or she wants to wear shorts or she wants to wear a bikini. So that is the time when people come in for these procedures. Then, as I said, we're going to be talking about the lower body lifts. Lower body lifts, again, as I said, they are used when we are going to be uh, talking about, when we're talking of sagging overall in the lower half of the body. So, आपकी जो बटक का sag है या आपके जो साइड के जो लूज स्किन है उसका सैडल बैग्स का sag है या फिर फ्रंट ऑफ द थाइज या इनर थाइज ये सारा जो है ठीक किया जाएगा doing a lower body lift and that requires a little longer period of healing compared to the thigh liposuction or just the thigh lifts. Somebody had asked me if the surgery painful. Now I don't know which particular surgery you're talking of. So if you talk of liposuctions, as I said, Or in fact, for that matter, we're talking of thigh lifts or even the lower body lift as such. These are not very painful surgeries, and most of our patients will not require painkillers beyond the first 1 week or so. And the pain is very easily controlled using these painkillers. So I would not say that it's a very painful surgery. Yes, you might have a period of discomfort of 3 to 4 days in the initial post-op period, but after that, it's quite smooth. So I wouldn't say that's a really painful surgery. So yeah, there's definitely one thing which I forgot to mention, that when we're doing a liposuction or thigh lift, then we would want that you wear something called a compression garment, and compression garment पहन के आप अपने जो भी you can resume your work as soon as you're comfortable. And someone is asking me about more live sessions related to tummy tucks. Okay, sure. So next time we're going to be doing maybe a session on tummy tuck. And yeah, somebody had asked me for a rhinoplasty, so definitely we're going to be doing this. Tummy tuck is, yes, one of the commonest plastic surgery procedures. And even now, if you have any questions regarding tummy tuck in particular, we can always discuss that, no issues. So, this is basically more or less in brief about lower body contouring. So, as I said, it involves liposuctions, it involves thigh lifts, it involves the entire lower body lift. So, usually patients come to us just about the upper part of, dealing with tummies and arms. But yes, many times many patients have a disproportionate body, जहाँ उनकी waist पतली होती है, उनकी arms पतली होती है, तो सारा का सारा weight जो है वो नीचे lower half of the body में होता है. This is very common in women. So uh, thigh liposuctions are again a very popular, plastic surgery procedure. The recovery is not very long, and if you're a person who is, not grossly overweight and you have these issues, as I said, you have the saddle valves or you have the inner thighs rubbing against each other, do come for a consult with the plastic surgeon. And this is a thing which can be really easily sorted out. And as I said, neither is the recovery very long, or nor is it a very painful